Here comes the, y'all don't really want it like that. Yeah. Here comes the, no. Here comes the, oh. Here comes the, y'all don't really want it like that. Yeah. Here comes the, no. Here comes the, oh. Here comes the, y'all don't really want it like that.
Lately, it's been difficult to talk about football without mentioning concussions. Why? Well, mounting concern over a disease called chronic traumatic encephalopathy, more commonly known as CTE. In the world of medicine, CTE is a relative newcomer. In football, we just learned about it 10 to 15 years ago. Here's what we can say. It's a progressive degenerative brain disease. It is like Alzheimer's. It can start with memory loss, mood swings, and difficulty in concentration, developing into progressive dementia, even possible thoughts of suicide. But unlike Alzheimer's, CTE can also result in significant aggression and lack of impulse control. The big difference, symptoms tend to begin much earlier in life, closer to your 40s instead of your 60s. In both diseases, there's no known cure. Researchers believe there's only one way to get CTE, and that is repeated hits to the head. What happens is that you get a buildup of an abnormal protein called tau in the brain. Scientists do know both the location of the tau and how much tau in the brain determines the symptoms you might exhibit. But scientists don't yet have a magic number of hits that results in CTE. It also isn't known who exactly would develop CTE. There are some players who take many hits and never develop symptoms. Factors like genetics and age of exposure to the trauma could play a role. How do you know if you have CTE? Just because you have symptoms doesn't mean you have the disease. In fact, as things stand now, you can only be diagnosed for sure after death. Scientists are researching how to diagnose in living people. A prominent group of researchers have found over 90% of former NFL players have developed CTE. Also, it's not just football players that need to be concerned. Boxers, soccer players, people in the military, anyone who's exposed to constant head trauma can develop it too.
Because the brain and its nerve cells are so fragile, sudden, rapid movements of the head can cause injuries. During one such injury, called coup contre coup or acceleration-deceleration injury, the brain bounces back and forth against the bony interior wall of the skull. In high-speed coup contre coup injuries, the impact may be violent enough to cause swelling and bruising of the brain tissue, called a contusion. However, in cases involving low-speed coup contre coup injuries, the resulting damage may not be visible to the naked eye.
The most significant contributory factor to CTE is exposure to blunt force trauma of the head. So what happens is that over sometimes up to 40 years, you would now begin to manifest in a progressive manner seemingly innocuous symptoms as mild as constant headaches, very subtle changes in personality, very subtle but diminishing intelligence, and then mood disorders, chronic alcoholism, drug abuse.
Are we talking like gentle slaps to the head?
Violent slaps that would make your brain move forward and backward, sideways in your skull, causing shearing injuries.
Though symptoms may be present for years, CTE can only be diagnosed after the player dies.
Now, after those countless concussions, even deaths, with Will Smith's latest movie, Concussion, concern is intensifying and people are questioning whether the beloved sport of football is simply too dangerous.